Karibu kwa CSTV Afya Kona. Afya yako, jukumu lako na Daktari Amos Mapesa.
So ladies and gentlemen, welcome back to CSTV. I'm your host, Catherine. And with me today, I have a visitor. I will allow him to come and say who he is, what brings him here, and what we are going to talk about today. So for the first time viewers, kindly remember to subscribe and kindly touch the notification bell so that the next time we go online, you can be able to get an alert. Karibu sana. So, Daktari, karibu sana.
Okay, asante sana. Thank you for the invite. This is Amos Mapesa, and I'm here to represent, to have a talk, and I'm so happy to be in this channel, this great channel. So we shall have a talk onwards. I have a BSc in nursing and Bachelor of Science about MSc in medical physiology. Thank you.
Wow. So, guys, the person I have with me today is somebody who has a lot of experience and expertise in the field of health. And I'm sure that it's going to be very, very resourceful in helping us unmask the entire issue about diabetes. And why do I bring this series of health is because we have several diseases outside there that actually sometimes we even don't understand how they come about. And when we have them, what is our fate or how do we even manage them? So, Daktari, what is exactly diabetes?
Okay, in simple terms, diabetes is simply inability of the body to control the blood sugars. It's a kind of dysregulated blood sugars level, in that you'll find that the blood sugars are rising, without, especially after eating. The blood sugars are expected to rise, but after some time, they should normalize to normal range. The normal range, it's usually between somewhere between 70 milligram per deciliter to 120 milligram per deciliter of sugars. Now, after eating, it usually rises a bit, and then it should normalize back to somewhere 70 milligram per deciliter. But you'll find that for those who are diabetic, who are unable to control these blood sugars, it will rise and maintain, it will remain at higher levels of closer to 200 milligram per deciliters. That one now is the body is being unable to regulate that the amount of sugar in the blood. And the component that usually regulates, it's usually this protein, a certain protein that is usually produced by pancreas, that enables the sugar to enter into the tissues, especially muscles. So whenever it enters into the tissues, such as muscle tissues, then it reduces. But with these patients, the insulin is, maybe it's there, but the receptors are dysfunctional. So the sugars are not taken into the muscle, so it will remain high in the blood or the plasma. And this is what we usually call diabetes.
And Daktari, when you say that the pancreas fails to release some protein into the muscles, and I'm just seated here and I'm trying to imagine what causes all this. Like, because I've seen small children with diabetes, I have seen the elderly, I've even seen people of middle age with diabetes. So is it like it's bacteria? Is it virus? So exactly what causes this inability of the body to regulate its sugars?
Okay, so we have several types of diabetes depending with the cause. Huh? So for children, mostly in children, you'll find it's type 1 diabetes, where the pancreas the endocrine pancreas, the pancreas that is the part of pancreas that that's usually mandated to produce this hormone known as insulin, it's dysfunctional. So if it's dysfunctional, especially the cells that produce insulin, if they are dysfunctional, they'll not produce the insulin. And you'll find certain autoimmune diseases usually destroy the cells. And these cells, if once they are destroyed, then it means that insulin will not be produced. And if insulin is not produced, then the sugar that is contained within the blood or the plasma will remain at that level, because it's only insulin that can make this sugar in the blood to get into the tissues. So that is in children, especially with autoimmune diseases that destroy the cells that produce insulin. That one is type 1 diabetes, and it's usually in the children. Now, to the elderly with type 2. And in type 2, you'll find that the cells within the pancreas, they're usually known as beta cells. These cells, yes, they are functional, they are producing that insulin, but now the problem is at the tissue level where the receptors are not sensitive to the insulin. So we have the insulin being produced and insulin acting on the receptors of this insulin so that sugars can enter into the tissues, especially muscle tissue or muscle cells. So the receptors are dysfunctional. In this case, this one we usually call it type 2 diabetes. So the cause may be different. Type 1, mostly in the children, autoimmune diseases, you'll find the antibodies that destroy the cells within the plasma. For type 2, you'll find that insulin is there, but the receptors are defective. They're not responsive to the insulin being produced. Okay. So the sugar will still remain high within the blood.
Okay. And Daktari, how then does somebody get to know that they are diabetic, or like I have diabetes?
Or the signs and symptoms of diabetes. You'll find there is usually a triad. There is a triad, or a classic triad of diabetes. So one of the signs, it's usually being thirsty, so much thirsty. Within the medical field, they usually call it polydipsia. So someone will find that they are always thirsty, they're just in need of taking too much of water. Number two, you'll find that they tend to urinate so much. So urination is increased. Within medical field, we'll find that they usually call it polyuria. And then there is this eating too much. One tends to eat too much, and then they tend to eat too much of the sugary things. This one, they usually call it polyphagia. So this is a triad that is classic symptom of diabetes. That is feeling too much thirsty, taking too much of water, two, eating too much of food, and then three is urinating so much, going to the short call too much. Mm-hmm. So if the three occur, then it's likely someone is diabetic. And then the other one that usually tends to occur, it's there's also losing of weight. So you'll find these people are eating too much, and at the same time, they're not gaining weight so much.
What?
So it's kind of a paradox. It's a paradox that is classic. It's actually classic definition of diabetes.
Mm-hmm. And Daktari,
so the three.
So she said here you are saying that you are eating too much, but you lose weight, and then you drink a lot of water, and then you go around you urinate too much. But is it not like somebody who drinks a lot of water is naturally supposed to urinate a lot?
I can see that it's kind of, but with this case, these are more of signs and symptoms.
Okay.
So usually after when a patient or someone complains of such, it's when now you proceed with the investigation to determine if it's real diabetes.
Okay.
So you have to proceed to investigations.
Okay.
And then now you'll tell if it's diabetes.
Okay. Now, and actually, does it mean that if I have diabetes, actually I will die?
It's a disease, and it's usually chronic, and it progresses. Once it progresses, it can lead to multi-organ failure. And then from multi-organ failure, it's when you can now, the body will be overwhelmed, and then death, it may be inevitable. But it can well be controlled. When you control the blood sugars, everything will be fine.
But when you say about multi-organ failures, what are some of the organs that are likely to be affected if I have a progressive diabetes?
Okay, so with the organ failure, the one that is likely to be affected, you know, the first thing, when the main problem is that there is elevated blood sugars. Within the blood, there's a lot of sugars there. So once these sugars are elevated, they usually form some toxic molecules. And then these toxic molecules, once they enter within let's say to the kidneys, through the nephrons of the kidney, they destroy the nephrons. And then you'll find that this person may end up having diabetic kidney failure. Okay. Because the nephrons that the functional unit of the kidneys are destroyed, and then they'll have what? Kidney failure. And then it can also destroy the nervous system. You find that there is kind of nephropathy, the neurons are destroyed. And once neurons are destroyed, most of the organs will not function well. You'll find also these toxic products that are formed due to elevated blood glucose. They can destroy even the retina, the eye, the retina of the eye, and someone may go blind. So all these happen across the body. In almost every organ will be affected. And then this will eventually lead to multiple organ failure.
And Daktari, let me say, if I have diabetes, is it possible that I can pass it to my child?
Passing, there's some hereditary component of diabetes. There's some, especially type 1. Type 1, where there is some autoantibodies. There's some molecules that they destroy the pancreatic tissue. With this type of diabetes, it's usually genetic. It has a genetic component of it. So it usually, you find it runs in a family. Certain family will find that family members have diabetes, almost everyone there. So there's a genetic component of it. So if someone is, let's say if someone has diabetes type 1, you'll find along the genealogical line of this family, someone else may also get this form of diabetes.
Okay.
Yeah.
And what are some of the factors that can expose one to higher chances of getting diabetes?
That's a nice question, especially with the current form of more of sedentary lifestyles. We'll find type 2 diabetes. It's the one that someone can have it if they are leading sedentary lifestyle. Let's say if someone adds weight so much, someone becomes obese. If someone consumes too much of refined sugars, the cakes, taking too much of sugar, this sugary food, and then lack of exercise, And then also consumption of alcohol. You know, alcohol can cause pancreatitis. It can destroy pancreas, and that's where this insulin is usually produced. And then also living a stressful life, or too much of stress, depression. You find there's certain hormones that are usually released, such as cortisol, that reduces the insulin sensitivity. So the psychological stress, now I'm talking about the psychological stress. You'll find with this form of stress, there's usually a certain hormone that is usually produced. It's known as cortisol. And whenever it's produced, it usually leads to low sensitivity of tissues to insulin.
Okay.
And this means that the sugars will rise automatically. So also this one may end up causing diabetes.
And Daktari, if today I'm diagnosed with diabetes, earlier on you said that diabetes is manageable. So what are some of the things that me as a diabetic person I'm supposed to take care of, or how am I supposed to manage it actually?
So the management, first, you must work closely with your physician or your doctor. Number two, you must work closely with your dietitian to manage your diet, because diabetes is all about eating, because the sugars come from the food we eat. So first of all, it's work with your physician who will prescribe some anti-diabetic drugs that will help manage the sugars. Number two, eating. Eating, it's so the kind of meals you are eating, they are paramount in controlling the blood sugars. And actually, management of diabetes is all about managing your blood sugars. So you have to eat food that is rich in fiber. You should not eat food that is so much refined with these simple sugars. They say kienyeji. You need just to go kienyeji. If it's a rice, you should not do the white rice, do the brown rice that is full of fibers. And then you have to do a lot of exercise, because it has been shown whenever you do exercise, you actually increase the chances of sugars to enter into the muscle cells. And you'll find that once sugars are entering into the muscle cells, you're actually controlling the amount of sugars that are within the blood or plasma. So it's exercise, following the prescription and the anti-diabetic drugs you've been given, and checking on your meals, avoiding simple sugars.
For a layman like me, when you talk about avoiding simple sugars, apart from cake, what else falls under simple sugars?
Simple sugars, it simply means a meal that has been refined, the process.
Okay.
Especially the supermarket stuff. So if you can, if it's, let's say you are making ugali, you should use the one that you've prepared. You've gone to the posho and prepare your flour, not the sifted one. So you just have to use kienyeji. You should just go kienyeji, and your food should contain a lot of fibers.
Okay.
Yeah, because they will delay. The reason behind here is that when you take meal that contains a lot of fiber, it delays the time. It delays the time of sugar entry into the blood. You know, digestion will take a little bit longer before these sugars enters into the blood. But with the refined sugars, once you've eaten, within few minutes, sugars are already in the blood. So it causes spikes. And these spikes, the blood sugar spikes, are the one that you try to avoid as a diabetic patient.
Wow. Wow, that was really educative, Daktari. It's my belief that my dear viewers, that you have learned something about diabetes today. Diabetes is not a death sentence. It is actually something that we can manage and take care of our elderly and those ones around us who have diabetes. So, Daktari, kindly your passing shot before we close the show.
Diabetes is very manageable, and people should just take the advice that they are given with their physicians or their doctors. Check on the meal you are eating, avoid the refined sugars, and then do exercise. At least in a day, you should have 30 minutes of exercise, and this will go along in managing your blood sugars and the diabetes. And then also for those who are not yet diagnosed, or you don't know your status, you should actually go make a visit, make a point, and visit a health center, a clinic, and then check on your blood sugars. Sometimes it's usually silent. So just make a point to visit a clinic and check your blood sugars, and that will be fine.
Wow. Wow. Thank you so much, Daktari, for giving us a lot of information and quite important information concerning diabetes. Kindly, my dear viewers, subscribe, share, and give this video a thumbs up. Daktari Amos will be with us next time again to talk about another disease. So if there's a disease that you want Daktari to speak about, kindly share your views in the chat box. We will definitely let him answer all the questions that we want him to answer concerning our health. So thank you so much, Daktari, and thank you for having you in the show.
Thank you so much for inviting me in your show too.
Okay.